Hello everybody, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss one of the most important topic of hair loss. The name of topic is telogen effluvium. By definition, it is increased shedding of telogen hair clump due to premature termination of anagen phase of hair cycle. Introduction and journal description. A scientist, Klingman, in 1961 described shedding of telogen hair as a disease state of a follicle. Investigation of endocrine, nutritional, autoimmune disorder, and androgenic alopecia in persistent case is required. Moreover, 100 hair shedding daily is considered to be a normal phenomenon. Pathogenesis. Haddington scientists describe 5 types. Number 1. Immediate anagen release. Hair follicles are stimulated to leave anagen and enter in telogen phase prematurely due to stress and certain drugs. Second is the delayed anagen release. Hair anagen phase is prolonged and recycling to telogen phase is reduced. Example, postpartum hair loss. It is mostly seen in a female in a period of postpartum. Third is the short anagen syndrome. Hair anagen is reduced and telogen phase of hair shedding is prolonged. Example in androgenic alopecia. The fourth is immediate telogen release. Hair short telogen phase due to premature exogen. Example, androgenic alopecia and use of minoxidil. Fifth is delayed telogen release. Here prolonged telogen phase followed by transition to anagen phase seen in animal. Telogen gravidarum. The telogen hair loss 2 to 3 months after the birth due to delayed anagen release. Example, pregnancy and oral contraceptive use. Acute telogen effluvium. Acute onset of hair loss mostly after trauma, high grade fever, sudden starvation, hemorrhage. Mechanism involved here is immediate anagen release. The regrowth can occur after 3 to 6 months if triggers are excluded. This is a picture of a patient admitted in a hospital. Hospital is a stressful environment. The patient hair are lost, weak and very fine in texture. Investigation include number first is hair pull test. It is also known as a traction test or Seburat sign. Second investigation is trichogram analysis, which shows 25% hair usually in telogen phase. This is a hair pull test. The method of hair pull test is very simple. Grabs 20 to 60 hair with the help of finger, index finger, thumb and middle finger. Grabs in such a way that they are pulled gently but not forcefully. Grabs them from the base and pull them in upward direction. If 10% of hair are shaded, then hair pull test is said to be positive. This is a method of hair pull test as I have already discussed. Chronic telogen effluvium. Shedding of telogen hair longer than 6 months. Causes include thyroid disorders, iron deficiency anemias, acrodermatitis enteropathica. It is a disease due to zinc deficiency. Marasmus, which usually cause hair shaft abnormalities, hypoproteinemias, liver disease, malignancy, SLE, syphilis and dermatomyositis. This is a picture of a patient having hypothyroidism and systemic lupus erythematosus. The first picture is of hypothyroidism. The patient with hypothyroidism, you can see the hairs are very fine in texture and frontal area is almost lost. And second picture, you can see the photosensitivity, hyperpigmentation involving the face and neck area, and also hairs are very fine in texture and lost from the frontal area. So SLE and hypothyroidism both are related with the hair loss. In this picture you can see the on the left side similar hypothyroid patient, hairs are lost from the frontal area. In second picture the patient is of uh, malnutrition having zinc deficiency. You can see the hairs are lost from the frontal area and temporal area. The diagnosis is punch biopsy. Drug induced telogen effluent. There are certain drugs which are involved in telogen effluent usually after 6 to 12 weeks of usage. The mechanism involved is immediate anagen release. And drugs are acitretin, retinoid, and minoxidil. Now, differential diagnosis include chronic telogen effluent and androgenic alopecia. The management is withdrawal of triggering factors. Primary chronic telogen effluent. It is idiopathic condition affecting middle-aged women of an age of about 30 to 50 years, described as a sudden hair loss for last 6 months. This is a picture of a female having sudden hair loss. You can see scalp investigation. On scalp examination, hair pull test, CBC, thyroid function test.